Hello there, welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. It is an important topic, and that is why I have invited back our good friend Mark Harrington. He's the Executive Director of Treatment Action Group, or TAG, and Ivy Kwan Arce, who is the President of the Treatment Action Group Board. Lovely to see you both. Thanks for making the time.
A pleasure.
Thank you for having us, Carl.
So Mark, when we last spoke, you said that we might face some setbacks in HIV progress. How much damage has been done at this point, and what's at risk if we don't act fast?
Well, at this point, the global international HIV program that was run by the US for the last 4 years has essentially collapsed. So about 20 million people living with HIV that were receiving HIV treatment through PEPFAR, the President's Emergency Plan for AIDS Relief, are either on their last few months of treatment because there was still some drug stocks in the countries, or have ran out of treatment and are not on treatment and are experiencing HIV rebound. And for people that may be pregnant, some of them will have delivered babies who are HIV positive because they were not on their drugs. And this has all been done by the administration because they destroyed not only PEPFAR, but they destroyed the U.S. Agency for International Development, which was how PEPFAR was distributing those drugs to a lot of countries. And then in domestic terms, what we're seeing right now is we're seeing a full-fledged assault on all the research institutions that have carried out the research, regulated the research, and designed the research that has led to PrEP and to highly activating retroviral therapy, or ART, which Ivy and I are both on and have been on for decades and are keeping us alive. And so the research, hundreds of millions of dollars of research programs have been frozen or stopped, and that means that it's likely that much research that's going on now won't finish, and it's even more likely that research that was being planned won't happen, or at least it won't happen with U.S. support. And these are all taking place in a context where this is just one small, for most people, this is one small side drama among all the other disastrous things that the new administration are doing to our country and our world, including destroying climate science and pulling out of international agreements and supporting the illegal arrest and kidnapping of a variety of people for political reasons or for speech.
Yeah, Ivy, from your perspective as someone who's living with HIV, are we seeing a return of sort of the fear and stigma within the community? And if so, you know, what's different about this political climate compared to what we've already fought in the past?
Well, I'm getting actually very different, feedback. I think people in the United States have never really faced like the actual fear of actually something bad happening. And, that's like a very cultural, how comfortable we've been. Uh, the global feedback of like being scarce with treatment or even HIV medication has always been like something we had to navigate. But obviously, in this moment where the U.S. is impacted, is the reality is something we have never seen. Like in the past, like 15 years while we had treatment, I've always said like if we don't keep on doing research on HIV cure, it's always going to be a problem. Not only like a $30,000 consumer cost to U.S. citizens on a yearly base, it's not really a cure, it's a treatment, but it's an accessible. So now that we're in all this structural destruction, it's not just about whether the medicine are going to be more expensive or more scarce, but also we're in multiple world wars that really can affect what I've always feared, which is the access to the ingredients that make these drugs. And I think nobody in the US has really grasped that. It said that, oh, insurance are going to go up, which they probably are in the pipeline. So for me, the anxiety is seeing these two worlds merge. What other countries, like Argentina still doesn't have pediatric formulation for HIV positive kids. That gap is that big. And to imagine a world where the pipeline of materials making these drugs will impact all of us. That anxiety is very real. And I think people have not even grasped that moment.
Yeah, Mark, HIV services are already being slashed here in the United States. What happens when we lose these programs? Who suffers the most? And how fast can we really backslide into a public health crisis as it relates to HIV and AIDS in this country?
Well, first of all, it's not at all clear that that HIV services will be dismantled in this country because the Republicans can't even get their act together in Congress to put together a bill that's going to both hugely reduce taxes on the rich and hugely cut social programs for the poor, including Medicaid. And about 75% of people with HIV in the country depend on Medicaid, and different states have different rules. But there's been a lot of opposition, even within the moderate Republicans, to cutting Medicaid. And so it's not clear what is going to happen to our infrastructure. Other parts of the infrastructure, such as the part that takes care of housing, federal funding for housing, or federal protections for LGBTQ people or for trans people, those have already been destroyed. And in many parts of the country, it's even more unsafe than it was before to be a trans person. It's become less safe to be a queer person. And being an HIV positive person or being a young person of color in the South who's trying to get access to something like PrEP or HIV treatment has gotten harder and will continue to get harder. But this will be a slow motion disaster because, like I mentioned, the 20 million people in Africa and Asia that had of whom ran out of their HIV drugs, that isn't being documented very well because the systems that gathered the data on those people were also funded by the US and the plug was pulled on all of them. So there's not a lot of surveillance going on internationally, and domestically, we know that they cut the funding for a lot of the CDC programs that follow these things domestically. So what we're going to do is hear more like anecdotes or human interest stories about individuals that are having trouble um, accessing treatment, and we will likely see a rebound of cases of late diagnosis of AIDS, people coming in very sick, hospitals being fuller with people with advanced HIV disease. But this is not going to happen overnight. It happens slowly because we had succeeded in getting our epidemic down to a level where, you know, there were less than 40,000 new infections a year. And people don't get sick. Most people don't get sick right away after they get infected. What we are likely to see is a huge bump in new HIV infections, both domestically and internationally. And the thing that breaks my heart is that we're already hearing stories about women that were expecting to have babies that were taking preventive medicine for their babies, which is also treatment medicine for the mothers. And it is estimated already that several hundred babies have been born internationally with HIV. And we're not even talking about ancillary programs like services for people with tuberculosis, which are also destroyed and which will also rebound. It's estimated the damage to health systems so far from this administration is worse than the first 3 months of the COVID pandemic, if you try to put that into perspective.
It's just shocking to me, and I think of programs like Ryan White that do such an important job, especially with ADAP and the AIDS Drug Assistance Program that I used, when I was first here in the United States. And I think about people who may not be out about their sexuality or who they are, and they're on their parents' insurance plans and things like that. And if we lose these programs like ADAP, where do they go? How do they get their treatment? How do we get to everyone being undetectable and untransmittable?
That's the fight that we're going to have all for the next 4 years. And one thing that we talked about last time was that, we tag and others are resisting every step of the way. And so, Ivy, how many times have you been in DC, and have you been arrested yet in Congress, or are you just trying to get arrested?
I've been arrested many times. Therefore, I'm really nervous leaving the country now and coming back to the country.
Yeah, we were just having that conversation a
Yeah.
little earlier about that. It's terrible. As an American citizen, I came through immigration 3 days ago, and I had a real level of anxiety approaching the desk, which I've never had, never should have. In a world, though, where this sort of fear is constantly being used to divide us, what most powerful tools we have right now to push back against the stigma and the silence, I guess, that is happening around all of this?
I mean, TAG believes that resistance is really part of our theory of change. And so, in February, when the news was covering that nobody was protesting, we were already protesting. We were at the State Department. We were at the State Department again a couple of weeks ago. Ivy was there with some coffins. We were in Congress last week trying to block a hearing. We were in Congress earlier today trying to block a hearing where Secretary Rubio was testifying. So last week it was Kennedy. So we're doing our best to raise a stink. We're doing it with our allies, both in the community, activist community, and also in the scientist community. And the scientists are, some of them are learning how to speak out. Others of them are still paralyzed with fear for losing their $100 million contracts with NIH. And the universities are scared because they're also on the firing line because of the administration's actions against Columbia and Harvard and others. And so what we're really seeing is a dismantling of a lot of the things that have made the United States work. If anyone else was doing this to our country besides the president, it would be considered an act of war against our people.
Yeah. Absolutely. And, to your point, you were just talking there, Mark, Treatment Action Group really has been a leader for, over 30 years in HIV advocacy. Ivy, I know people want to get involved. How can people support the fight today, support organizations like TAG and what they're doing?
Well, I think, the general way we've engaged with community and part of the community has been resisting. So we have that history. We still have those partnerships, but we also have to encourage new ways of organizing. And some of it's like as simple as we have a health fair, for example, every year. That started during COVID. And this year I actually have tapped into people that have actually been as medical doctors involved during COVID and saw the disparity. I actually have somebody that's coming into the health fair that just graduated today and announced her nonprofit for legal help for people who are denied health care. And what that looks like at this moment, obviously, when she went to school 4 years ago, it did not look like this. But she's starting a nonprofit and she'll be there at the health fair. We're starting with things like helping people actually change their name from beginning to end, to seeing the gaps that are happening in the city clinics, what is being defunded, and talking to NYU, for example, that right after the election, without a mandate, decided not to do transitional surgery for people under 18. It was immediate. So those things need to be challenged. We need to find people like the opposite of Paul Weiss that would take $40 million to represent Trump. We need to find the opposite of that. And those scholars teach at these universities. They need to hold the line as well. But they should be involved with the community where they can find new opportunities of helping people with this kind of like a variable, because this is a variable that we have not seen. But yet we constantly have to be engaged with people that are in the opposition to carve the same kind of, just like they imagine destroying the country, we need to imagine what not destroying the country and how to build it up with those things are.
Yeah, and you have both been in this fight for literally decades. Let's try and finish on somewhat of a brighter note. What gives you both hope right now? How can someone who's feeling overwhelmed today take action that actually really matters in this fight? What's giving you that hope, and how do we inspire others?
There are so many micro demonstrations going on across the country every single day. All you need to do is go online and do a search for a local resist action or an anti-Tesla action, or there's been really virtually every week a demonstration here in New York about the administration, some days, some weeks more than one. We at TAG have brought in a trainer from ACT UP New York who we worked with 35 years ago when ACT UP was first forming. She came to TAG and trained all of our staff and some outsiders who wanted to get involved in the ins and outs of civil disobedience. And then everyone went to the next march in New York City. Some of them were marshals, some of them participated. And so we're passing on the skills to a new generation of activists. We need them to join us. We need them to use their digital smarts and skills in ways that really maybe haven't been thought of before. It's not going to be easy to get, say, onto the NIH campus the way we did. Today is the actual 35th anniversary of ACT UP Storm the NIH demonstration. which was a huge success and led to us being involved in all the research that's happened since then. But just like every day of our work, the possibility for change exists. And if we get together and work together, we can make change happen for the better and fight back against these idiots.
Yeah, well said. What about you, Ivy? What gives you hope right now?
Well, my hope is it's like a version that I've been hoping for a while is that the organizing on the street is something that we're very familiar, but I've always been focused for quite some time about the organization and advocacy that we can have with people that are emerging doctors and researchers and make them more of a part of the resistance, because we do need science in the mix of it. Sometimes like the street demonstration has this limitation of that event versus people that have been working in this fields for, I've been a big fan of finding out when people can break patents, for example, like diabetes, a lot of people can afford the medication. And you have young people that have been in chemistry for a while that would change one ingredient to make it possible for them to actually have the diabetic medication they need. So we kind of need that. And we need to re-engage with people that we have long history. I was looking up like who's in the NIH right now or in government that we have relationships that still have a good relationship with the current administration or the charms to continue those discussion and share the consequences of that, or the amazing thing that the one thing that worked. They're defunding it and having people that they like or are more from, safe to talk to. So those are the things we need to continuously harvest. Who are the people inside that can make a difference? All the new people, and I think we are also getting that feedback internationally. We know a lot of people that don't have the constraints that we have in this country to continue the research in some ways or manufacture medication. So it looks very different, but I think that's what my hope, that all the stuff we invested in relationship globally would somehow also be um, a partnership in helping us solve this.
Yeah, it's all about collaboration. Mark, Ivy from our friends at Treatment Action Group, thank you for this important update. I will be calling on you again in a couple of months and we'll have this conversation again, because you two are, as I said, you have been in this fight for decades. You're there literally on the ground and cause trouble, which we love. So I'll be checking back in with you. Thanks both for joining me.
Thank you so much.
Thank you, Carl. Thank you to your team. Thank you.
Of course. Now, if you found this conversation important, remember you can leave a comment, you can like, follow, and share. We are across all your favorite social platforms at Plus Life Media. Until next time, keep fighting, stay informed. We can make the change and the difference. Bye-bye.